got my, typical medical student salmon, and clam chowder. That's not a typical medical student dinner, right? Who cares? We're not typical medical students. What's up, guys? How are you doing? Welcome to the Mr. and Mrs. Lopez channel. As you can see, the Mrs. isn't here right now. She's actually right here, eating in front of me.
Hey guys.
And there goes her lovely fingers. And like promised, I'm gonna make videos once a week. So this video is gonna be about my internal medicine rotation, the first rotation I had as my third year in medical school. So we actually just got back from Tampa, Florida, driving a few hours because we're gonna go visit some family over there. Life's busy, so we just got home. It's 9 o'clock right now. We're about to eat. I got my, typical medical student salmon, and clam chowder. That's not a typical medical student dinner, right? Who cares? We're not typical medical students. So about to eat that right now. So like we promised, gonna have the videos up for you. This video, like I said, is gonna be about my first rotation in medical school as a third year medical student. So like I said before, medical school is 4 years. Your first 2 years are basically classroom, lectures. You do have some patient interaction, but it's mostly learning medicine. It's learning the body, the anatomy, the pathophysiology, the pathology, which is all the diseases. It's learning the pharmacology, which is the medications. It's learning the physiology, which is how the body works, how it functions. It's learning principles and ethics and how to be professional in medicine. So third year and fourth year, it's when you branch off. And you already learned the medicine, so you think you did. And then you get in the clinical world. They beat you up, man. And then you get in the clinical world, your third and fourth year. That's after you take your step 1 exam, your board exam after your second year of med school, okay? So we're gonna talk here a little bit. It's gonna be real quick. It's gonna be brief on my experience in my internal medicine rotation. Internal medicine is the study of the body, and internal medicine has a lot of different specialties. And mostly every specialty is geared towards organs. So it's geared towards GI, the gastrointestinal tract, which is basically the mouth all the way to the anus, literally. You have people that specialize in rheumatology, which is the study of diseases of autoimmune disorders, which are disorders that attack the body. Basically more of like people that have rheumatoid arthritis and scleroderma, and a lot of these diseases that are common and some that are really rare. You also have specialists in cardiology, so people that just study the heart, people that are just the physicians, the doctors that are just worrying and studying the patient's heart and seeing what they can do about their heart, medicine-wise, and these are all things that a primary care doctor can do. But when it gets really complicated with some of these patients that have like 5 or 6 diseases, that's when the specialist comes in. So internal medicine is 3 years for residency. So you're in school for medical school for 4 years, and then you have to pick your specialty. If you want to do internal medicine, it's 3 years after medical school. That's residency, okay? Residency, you get paid. You don't get paid like a doctor, but you get paid. You are working. That is a job. And then if you want to subspecialize, like this cardiology, this GI, this rheumatology, what else is there? Why am I forgetting so many? Endocrinology, all these different ones. That's 3 years extra. So it's 6 years post-medical school. So it's a long time. But if you love it, it's worth it. As you can see, I kind of cut myself. I was just
I saw that.
getting a little bloody. It's getting a little bloody, but it's okay. It's getting real. So I just have my iPad here. I'm just kind of like trying to stay on task. So first thing I'm talking about is my schedule. So everyone wants to know, oh, how's life like in medical school? Is it so busy where you don't have time for anything? Is it so not busy that you have time for everything? Yeah, it's a little mixture of both. It's more on the busy end. Obviously, you're in medical school trying to be a doctor, right? So outpatient versus inpatient, I want to talk a little bit about that because that's what you're going to get
for medical school. For some things, you're not gonna have outpatient, some things you're not gonna have inpatient. But for internal medicine, we had a few weeks of outpatient and a few weeks of inpatient. What is that? Outpatient is what you've probably been to in the doctor's office. That is outpatient medicine. That is where a doctor has a clinic, has a practice, and the patients come to their practice. And when the patients come to their practice, they work them up. They either diagnose them with a disease or they're preventing a disease from happening. They prescribe medications or they don't prescribe medications. They perform tests or they don't perform tests, and they get their overall health up to par. And then they send them home. They don't stay there. It's a clinic. It's a drive-through, right? That's what it is. Inpatient medicine is the big hospital. It's a big facility. When a patient gets admitted to the hospital because they have a heart attack, because they have a disease, acute attack of their disease, if they have an emergency, they go to the ER and they get admitted to the hospital. That is inpatient medicine, where they stay over the hospital overnight. So my outpatient experience was pretty cool. I learned a lot. I got there every day at 7:30, and I left about 5 o'clock every day, and that was it. Okay, Monday through Friday, no Saturday, no Sunday. That's outpatient medicine, and that's why a lot of people like it. As you can see, you have a life balance. So it lasts until about 5 o'clock, and I saw patients. As a third-year medical student, you're expected to go inside. You're expected to say hi to the patient, get a full history on the patient, do a full physical exam, come outside, figure out what you think's wrong with the patient, come up with a plan, and present the entire patient to the doctor, and then you walk in together. It is so fun. First couple days, you kind of struggle a little bit, and then you get the hang of it, Then you get the hang of it, and it becomes awesome, and like you are a little doctor. So after the outpatient, I did inpatient. So that's where the hospital comes in. So I was with hospitalists. Hospitalists are internal medicine doctors. Some are family doctors as well. And they stay at the hospital. They don't have an outpatient practice. They don't have a clinic. They have the hospital as their clinic. So they are in the hospital as their job. All right, they're employed by the hospital, or they are employed by a different entity which has physicians that work in hospitals. So this is where we see patients that you don't know. You don't know these patients. You don't know this guy that you're seeing in the bed that's been having this liver issue for 5 years, because you're not his doctor on a regular day basis. The outpatient doctor, the one that has the clinic, knows that patient. And so this is where medicine has really shifted, because you have these physicians now that know a lot, that are in these hospitals, that have these patients come in, and they are the doctors for them while they're in that hospital stay. There's some doctors that still do this, and what they'll do is, if they're a primary care doctor or if they're a physician that takes care of that patient in their office, they have privileges to go to the hospital if that patient gets admitted to the hospital, and then they take care of their patient in the hospital. And that's what some doctors still do, but it's kind of fallen off, and the way it's working is there's going to be an inpatient doctor called a hospitalist, and there's outpatient doctors. So inpatient doctors, man, it's like when you feel like you know so much in medical school, you study for the boards, you know all these diseases, you're like, give me it, man. I know all these labs, I know what to work up, I know what to order for this patient. And you get to the hospital and you feel like a newbie again. You feel like a newborn. You don't know jack. You're lost. You're asking for directions. You're looking like a bird that just came out of the shell. It's amazing, but it's such a good experience. And there's so much that has to do with the hospital. There's so much that you have to take in at once, and it can be overwhelming, but it is fun at the same time. And you are putting in orders. You can tell the physician, hey, I think this patient needs this. And they're saying, you think they need this? Okay, let's think about it. Let's order it. And so it's kind of like a game, but you're actually dealing with life. And it's a life or death situation, and not in all cases, but that's when you have to take it real seriously. You have to say, man, you know what? I am basically this person's mini physician. And of course, the doctor is looking over you. You have a doctor, a medical school that is your faculty doctor, and they teach you a lot. But the majority of it is kind of self-learned. I mean, you're gonna have to come home and study, and that's another thing I want to touch on, because when you're in medical school, the reason why life is so busy, it's not necessarily because you're in the hospital all day. It's because you're in the hospital for the majority of the day, and then when you get out, you have to study, because you have this little exam at the end of each rotation called the shelf exam. So you have your 6 to 8 week rotation, and then you have a shelf exam after. It's not like you just go to the next rotation. No, you have to take an exam for that specialty. So I had to take an internal medicine exam called the shelf exam after those weeks that I did in the clinic and in the hospital. And so when you get out, when I said I went in at 7:30, got out at 5 for the outpatient sector of it, I basically got out, worked out, did whatever I had to do, and then I had to study every day. That's what you had to do. Inpatient, I have to go there really early, probably about 6 a.m., right? 6 a.m., 7 a.m. Wasn't that early. Round on the patients, right? Which is basically seeing the patients that you're assigned to, and you're following them every day while they're in the hospital. So in the morning, bright and early, you wake them up and you gotta do rounds on them. You see how they're doing, you see how their labs were, and you ask the nurse how they were last night. See, did they sleep good? You know, everything like that. And so you make notes of that, and then when the physician comes at whatever time they come, then you explain every patient to the physician, because you are the messenger. And that's what your job is as a medical student. And then you have to get out and study. And that's the thing that is kind of hard, to balance your life with medical school, because you're not done when you get out. Like a lot of people have 8 to 5 jobs and they're done. No, you're not done. You have to study, because you're not just trying to do well in this exam when you get out, but you're trying to be a good overall well physician. And also, just like I said, you have these little exams at the end of each rotation. You also have a huge exam at the end of your 3rd year called the Step 2 exam. So remember I said there was a Step 1 exam? That's your board Step 1 exam, your USMLE Step 1 exam after your 2nd year med school. Well, after your 3rd year med school, this year that I'm doing now, you have your Step 2, your USMLE Step 2 board exam. That's a big exam as well. Step 1 counts more than the Step 2, but it's still a huge exam. So, and it encompasses all of 3rd year. It encompasses all of the specialties. So we already talked about outpatient versus inpatient. I want to talk about reading up on your patient. This is how you watch all these shows on TV and everything, and you see them kind of like think about the patient right then and there. And that's true. You think about the patient right then and there. You see what they're presenting with, and you find out what's wrong with them. But you also have to go home and read about it. You also have to say, man, I haven't seen this rare disease in so long. I mean, this person has jaundice. They're yellow. They're bright yellow, but then they have like all these little bumps everywhere. I don't understand what's going on. And then they're saying their belly hurts. Man, let me read up on this. Or maybe if it's a rare disease, what is this disease? And you read up on it, and that's how you get to know it. Because at the end of the day, then you'll have a patient face to put with that disease, and it'll stick with you forever. It is so dramatic, and it will literally touch your life, because you're taking care of this patient and you read up on it. You're like, man, yeah, that patient did have this, and they did complain about this, and it's right there in the literature. And it's when it matches up like that, it's so amazing. So I already talked about reading up, talked about outpatient versus inpatient, talked a little bit about my schedule, talked about feeling lost in the hospital, and that there's people that are just sick. They're just really, really sick. If you get admitted to the hospital, that means you're not well enough to leave and go home. The doctors don't feel comfortable with letting you go home. And so obviously there's sick people there. And the last thing I want to talk about is just studying in general. When you're in medical school, you gotta study. This is the name of the game. You gotta study, not only because you have that exam at the end, but because you want to be a good doctor. So it doesn't matter if I don't want to do internal medicine. It doesn't matter if I don't want to do surgery. It doesn't matter if I don't want to do pediatrics. That does not matter. What matters is you putting all you have into that rotation, because it'll help you in every single part of your life as you go on and become a doctor. Because little things are going to come up later on in the future, and you're like, man, when I was a 3rd year medical student, I remember that. And all these professors always tell us that, like, man, I remember when I was a 3rd year medical student, I remember I had this one patient, and they just touch you, And so that's what I want to just leave with you guys. Just remember that it's about people. It's not about you. It's not about the money. It's not about the fancy cars and the house that you might get as a doctor. It's not about how long the schooling is. It's about you being a servant to others. And I believe that's why I got drawn to this field. At first, it was all glamorous. It was like, yeah, man, doctors make a lot of money. This is awesome, man. I want to do this. This is cool. They make a lot of money. Great. They help people. Great. But now I'm seeing this as a different aspect of it. It's just about helping people that need you, that are sick, that need your comfort, but most importantly, they need your knowledge. They need your skill. And so it is such a privilege to be in medical school. It's such a privilege to become a physician, and this is not something to take lightly. So I'm just so thankful you guys tuned in. Next week, I'm gonna have a video of my surgery rotation up. That's gonna be cool. There's some crazy stuff to talk about. That's obviously a more crazy rotation. A lot of people talk about. You see it on TV, see it on YouTube, and I'll show you my experience of what happened with me and how it was for me. It was pretty cool. So thank you guys. More videos are gonna come up. Jessica's gonna post some more videos too. She's right over here.
Hey guys.
So more videos are gonna come up, and we love you guys. So we thank you for watching the video. God bless you. If you don't know the Lord, He knows you. So we love you. We thank you so much. Gee.